Good evening. This is Sarah Martin presenting case study for week 12 of MSN 616C, Care of the Chronic and Complex Client Conditions Practicum. I will be presenting a case study on a 68-year-old male who presents to the clinic today with primary complaint of his insulin not being effective and having to use an increased amount of insulin for the last 1 to 2 weeks. Patient presents today stating that his insulin is not really working very well. He states that he has been dosing Novolog throughout the day for the last week to 2 weeks because his blood sugars have been increased. He states that the insulin does not seem to be helping. He is currently taking 2JO 28 units at bedtime and then dosing fast-acting insulin, Novolog or Aimovog, 10 to 12 units via bolus 6 to 7 times per day. He has been using the Libre continuous glucose monitoring with the download of the information performed today. His average glucose was 219. GMI was 8.7%. Time in ranges, 36% very high, 34% high, 29% in target range, 1% low range, and 0% in very low range. The patient states that he has been struggling recently with increased thirst, hunger, and urination. He has also been struggling over the last several weeks with increased appetite and marked difficulty with making appropriate food choices. He states that he's been drinking regular pop several times a day and eating ice cream on a daily basis. He did receive an eye exam recently, which was unremarkable for any diabetic retinopathies or any sort of diabetic changes in his eyes. He does state that he has regular standing appointments for trigger point injections with the back specialist and has also been having sacroiliac injections for low back pain with steroids, which could be contributing to his increasing blood sugars. Review of systems: constitutional negative, HEENT negative, cardiovascular negative, respiratory negative. Cardiovascular denies any chest pain, respiratory denies any shortness of breath, GIGU, patient does have occasional diarrhea, which is not out of the ordinary for him. Neuromuscular negative, skin negative, hematologic and lymph negative, endocrine immune allergic negative, psychosocial behavioral negative. Physical exam: blood pressure 122/58, pulse 82, temperature 98.2, height 6 feet, weight 277 pounds, SpO 294, BMI 37.57. Physical exam: constitutional alert, well appearing normal effect. Skin, normal color, no rashes, suspicious lesions. Eyes, people are equal around reactive to light, and extraocular movements are intact. ENT, normal external ear canals, and tympanic membranes bilaterally are normal. Normal nose, nasal mucosa, no nasal drainage, normal oral pharynx, teeth and gums. Neck, supple, no thyroidomegaly, adenopathy, or masses. Chest exam: chest is normal appearing, CTA bilaterally, lung sounds are clear, no rails, rub, bronchi, or wheezes. Cardiac exam: normal cardiac exam, regular rate and rhythm with no murmurs, rubs, or gallops. S1 and S2 have been noted, and no lower extremity edema was noted. Abdomen is soft and untender with no masses and no hepatosplenomegaly. Lymphatics: no cervical lymphadenopathy. Musculoskeletal: normal inspection, palpation, range of motion. Strength and in the upper and lower extremities are bilateral and normal. Neuropsych: patient is alert and oriented with memory intact and normal affect. The assessment for the patient is that he has type 2 diabetes, poorly controlled. Plan for the patient is that he will stop drinking regular soda. He's going to increase his 2JO insulin or 2JO injection to 32 units per day. He's going to start Trulicity at 0.75 milligrams weekly with his first dose initiated in clinic at our visit today. He is going to take his Novolog 10 to 14 units with meals, and note that there needs to be a 3 to 4 hour time limit between each dose of insulin to avoid for multiple daily dosings. If his blood sugar is over 200 before he eats, then he should take 14 units of the fast-acting Novolog, and if his blood sugar is below 200 before he eats, then he should be taking 10 units of the fast-acting insulin. He is going to call Advanced Diabetic Solutions to get his Dexcom sensor filled, and he is going to see the diabetic educator with his wife. Thanks, guys.